Thank you, Karen. Thank you, panelists. Again, my name is Ed Cameron. I work at Community Teamwork in Lowell, and I'm the Associate Executive Director for our Housing and Homeless Services. I've been working in this field, like many of my friends in the room, for a long time. It's been 25 years. I've seen this issue from a lot of different perspectives. I've worked at the Pine Street Inn. I've worked at the City of Boston's Emergency Shelter Commission. I've worked at Horizons for Homeless Children, and I've been at CTI Community Teamwork for the last 7 years. I sometimes joke with people that I knew more about homelessness 25 years ago than I know now. And the reality is it's a very complicated problem. We've moved it from DTA to DHCD, thinking it was more of a housing problem, but I still remain convinced that it's as much about the social supports that we can provide to families. Right now, CTI provides shelter to 63 families every night through our EA program. We have a DV program for 19 families who have been victimized by domestic violence that's funded by DCF. And for the last year and a half, we've helped house over 1,000 home-based families, working in the Merrimack Valley with our partners at Emmaus, House of Hope, and Casa Nueva Vida. We see that shift to programs like home-based as being very essential. We focus on preventing homelessness. When we can't prevent it, we do whatever we need to do to make that family safe, whether they miss the safety net of EA because they're not eligible, or whatever the issue is. We step in with community partners to make sure people are safe. Many times that's through our Housing Consumer Education Center. We support, in general, the reforms. We certainly think there need to be steps taken to make sure that families are safe. But to my mind, the EA safety net that we've had for over 25 years, it's kind of like a car company that's been selling the same old tired product for way too long. The customers don't necessarily want the product is defective, and the customer doesn't get from the product what they need out of it. But the product is the only thing that we've been offering them. This would be like if a car company was selling, the customers wanted a Honda Civic or a Corolla, something simple that worked for them, and we gave them a Yugo. So we need to try something different. At CTI, we fully support expanding MRBP and those housing supports. RAP has been a huge help since that came back, and I was certainly a part of protesting when that went away, and that's been really crucial. We also need to work at the community level. It was interesting to hear the Children's Hospital people talking about the hours their social workers are putting together. That needs to connect to the system, so we really need to have all the partners at the local and regional level. Now it's my pleasure to introduce Keisha Torres. Keisha's from Haverhill, and she's going to tell you her story.